So certainly there are groups of patients who have structural changes to their airway, so particularly their upper airway. So if they have anatomical born with, or because of some surgery or something else, have just a structural problem where their airway isn't as large as it otherwise should be, or they have trouble sort of managing their secretions because of a structural problem, then in those scenarios, sometimes tracheostomy can be a decision that is made to allow either treatment to be directed towards that area, or for there to be time for growth. That we know that kids who grow, everything grows, and sort of if their airway grows and whatever the issue is that's here maybe over time gets better, then there's a decent sort of scenario where they will get to a point where decannulation or taking the tracheostomy out, tracheostomy tube out, is a realistic sort of scenario. I'd say that's probably one of the more common scenarios of sort of a temporary tracheostomy. The other group is where there is floppiness, sort of a subset of what we just talked about, but some floppiness to the airway, or something called malacia, where the airway just isn't as open, and you can have both tracheomalacia, so in the airway, the upper part of the airway, or bronchomalacia. And in those settings, again, we think of that as often improving as children get older, as their airways get bigger, as they get stronger. And so sometimes a tracheostomy is used to help provide adequate ventilation and oxygen and help them breathe for a period of time until hopefully their lungs and their airways get stronger. I think there's a large portion of other patients, particularly at a place like Boston Children's, who we see who have alterations to their central nervous system, either because they're born premature, have some sort of genetic diagnosis, metabolic disease, something that involves multiple systems in their body. And often when that is the case, there are other pulmonary issues that come up. And so things like aspiration, recurrent pneumonias, infections lower down in their airways. And with those illnesses, sometimes they need to get admitted into the hospital and receive extra breathing support. And there's many different ways and mechanisms with which in the hospital we can provide breathing support. But after a period of time, if that continues to happen, and there's longstanding damage to the lungs, then sometimes tracheostomy is considered as a means for various different reasons to help provide a stable way for them to breathe, to try to be able to remove secretions, those sorts of things. But that can be a really challenging decision to make, because it doesn't come without risk, or in that population, in comparison to the previous, about, is this going to get better? Do we anticipate the frequency of these illnesses or episodes or exacerbations to get better for any reason? Or because of the underlying disease, do we expect it to continue to progress?